That's an amazing their own point of view before. Because there are a lot of programs and initiatives right here in countries of low socioeconomic state not getting enough funding, right? I believe that if countries are well funded, then some nurses will choose to stay back, and then those countries can choose to train their own nurses, because I see that some countries depend on Nigerian nurses a lot. United Kingdom, US, they depend on black nurses and nurses from this part of the world a lot. And so if they can take their time to train people from their own populace, I believe it will help. And I think I've heard people say that people over there may not be interested in the nursing profession. I don't know how true that is. I don't know how true that claim is. But if they have to consistently keep bringing foreign trained nurses on board, then that goes to show that it's possible that people in their own economies are interested in other things, maybe communication, ICT, digital or technological skills. So I don't know why they're not interested in humanitarian. Yeah. So I think what they can do is to help to fund, like they've always been doing, to fund more and support initiatives that help the healthcare system down here.
Interesting.
Interesting. All right, let's go to Lagos. Doreen, we're not doing it alone at this year. Lagos is joining us. Abuja is taking the conversation. We're crossing to Lagos now. Our colleague Doreen is in Lagos. She's going to ask you the next question. Doreen, over to you, please.
Good morning, Adesua. Thank you so much for all that you've shared with us. Please, my question is this. Can you give us some examples of countries that have successfully balanced migration with nurturing their domestic nursing workforce? Countries.
I'm sorry, because sincerely, I've not really taken my time to see, are there countries that have been able to successfully balance that? I've not done my research in that perspective. Trust me, I haven't, because when you're saddled with the other side of the coin,
what do you think can be done concerning this?
I think what should be done is to start from the cradle. If a child has been brought up with that mindset, that okay, a compassionate mindset, a nurturing and caring mindset, that child will maybe naturally tend towards that pathway later in life. Maybe when she has to go into high school or go into college, they may think in that direction. Because if you don't have a child thinking about compassion or thinking about helping people or caring for people in that dimension, in that point of view, then they will not go into nursing. You would not find them going. They'll go, trust me, I hear a lot of people say that nursing, medicine are humanitarian courses and they don't necessarily have so much money pumped into them, especially in this part of the world. So those countries can actually begin from the cradle, make them see things and experience things that make them more compassionate, and then begin to think in that direction and say, okay, I think I want to choose nursing. I think I want to go in this direction. I want to be a doctor to be able to help people, right? Because if you're thinking about money always or comfort, you might not think about nursing or medicine.
All right. Let me take it over. Let me
take it over.
All right. Thank you very much, Doreen, for joining us from Lagos. Just before we wrap up the segment, Dr. Adesua, let's talk about ethical issues. Do you believe the current ethical recruitment guidelines are enough, or do they need more enforcement? What more should be done? Is she still there?
Yes, can you hear me?
Yeah, can you hear me?
Yeah, can you hear me? Do you believe that the current ethical recruitment guidelines are enough?
Or do we need more?
Or do we need more enforcement?
What more should be done?
What more should be done? Because it goes beyond anybody just showing interest in care. You can show care and be mean. You can show care and not be ethical. You can show care and not be professional. Do you understand?
Yes, I think I understand where you come from. I think more should be done to enforce. Trust me, there can be policies. People can put together anything, and people may show interest. But if there is no enforcement of those systems, then it will not work. I think more should be done, and I think the media has a lot to contribute, because our young people that are deciding on taking course of action regarding their career are on the media, right? They are saying things every day, and since they go around with their phone, with their gadgets, their devices every time, the media can actually do a lot to help form their mindset about these things, and probably begin to see these policies as important, and then these implementations actually come to place.
Interesting indeed.
Interesting indeed. Thank you so much. Well, we've been having this conversation with a trained nurse, and I understand that you are a nurse, a coach too as well. So I think it also brings to one's mind. Final thoughts. What would be your final take on one particular policy you expect the government should put in place, to help the profession gear up and to sustain the protect the professionals, and also, of course, retain professionals in low-income, nations. I don't want to call Nigeria as a low-income nation because we have a lot of money. So, what do you think we should do as one particular policy that will help us to retain nurses?
Okay, I think I like that perspective you came from. We actually have money, but I don't know where I cannot say I know where the money is going to. So I think a policy that can be put in place is to, nothing was not even in this. We were talking about $400 as the average, which is actually lower, but about 20 years ago it was actually much lower. And then we the wife of Gowon came on board, and then we learned that she was a nurse, and then that's she put in policies that helped the remuneration become better. If working conditions, working environment, and remuneration is looked into and put into policy, I believe it will help. Just the doubling, we're talking about tripling and getting it somewhere close to what developed countries earn. It may not be realistic for now, but if we look into doubling the present pay of nurses, let me use for example in government institutions, because I don't even want to talk about private institutions right now. That's a totally different ballgame. I don't even know where we want to begin to correct that one from, because people like me open private institutions, and then they ask me, how do you expect me to afford to pay you 100,000 naira, just 100,000, which is how much? Like, trust me, looking at the economic situation now, I'm earning less than what I was earning 12 years ago, 15 years ago when I got into the nursing profession. I sat with somebody to explain. I said, if I go on with my paycheck every day, I know how much I get to use to buy this and that. And comparing it to now, it's not even enough. It's not going anywhere. So it indirectly means I'm earning less now. I'm not, in the figures, it looks like I'm earning more, but technically, looking at what it can afford to get, we're not going anywhere. So I think that the government should pump more money into the health sector, and then make working conditions better. Because trust me, even at my workplace, there are days where even thermometer, common as thermometer is, you have issues with it. BP monitor, you get a lot of a store full of.
I can imagine the passion, but time would not allow us to really, dive into that. And of course, the network didn't do justice at all this morning. But we hope to have you next time to have this conversation with you, because we have a lot to, unravel, especially that private sector that you mentioned. We have a lot to talk about. But thank you once again. Thank you for your time, and thank you for joining us on the Front Burner today. Thank you once again, please.
Thank you so much for having me. God bless you.
Amazing. Thank you. All right, so we'll go for it.
We get to the news, and after that, it will be hashtag on the morning show. Stay with us. We'll be back, please.
Ellen 24/7. is first of all a news station.
Well, we continue with updates from the just concluded governorship
in the Southeast has raised questions if INEC will be able to conduct elections.
With a core team of over 40 correspondents spread across Nigeria.
This is the Otedola Bridge, the famous Otedola Bridge.
We are not here to beg, but we are here to fight for our lives.
And affiliates in Africa, Europe, America, and Asia.
Under heavy security here in Lagos, Nigeria.
We give you news as it breaks from a perspective you can trust.
They told us that they are going to be here from 7 a.m. and they've been here since morning.
And 24/7 news.